now we're gonna open the Acción town hall, where we will hear from our amazing panelists, recognizing the disproportionate impact of Alzheimer's disease and related dementias, ADRDs for short. Poderistas partnered with the California Department of Public Health to curate a discussion that we hope will raise awareness of ADRDs and help reduce the stigma around all of this disease within our community, the Latino families. This panel will also provide crucial information on recognizing the signs of Alzheimer's within our family members and potentially ourselves. I am now thrilled to introduce our moderator, Yarel Ramos. Yarel, she looks gorgeous. You understood the assignment. Yarel Ramos is a Los Angeles native, born the first of 3 children to Mexican immigrant parents in the San Fernando Valley. Hey, Mexicana. Yarel joined Univision Los Angeles in April 2017 as the anchor of the newly added midday digital show Edición Digital California. That was a mouthful. I got it, right? And her career in television has spanned 8 years, serving as host, MC, and anchor. Thank you, Yarel, for being here with us.
So good to see you, and likewise, beautiful as always. How are we doing today? Yeah, having a good time so far? It's so nice to see you all, and I'm so proud of you for making the time today and coming out here to this event and learning and nurturing yourself and going back home and taking everything that the amazing panelists and what the production team has put together for you. So give yourselves a round of applause. I know it's hard, it's a weekend, we've got many things to do, but it's important to put yourself first when it comes to your health. Once again, I'm Yarel Ramos. I anchor a newscast on Univision called Edición Digital California, amongst many other projects that I do with the company. And mental health, self-care, wellness have been very instrumental in my life for the last few years, more than anything, especially since the pandemic. I know that we all kind of took that time after to be like, what's going on with our mental health and with health in general, right? So that's what we're doing here today. I'm super happy that that this beautiful event is creating the space to also talk about certain illnesses that are affecting our communities disproportionately to other communities. May is a meaningful month. We just celebrated Mother's Day. Felicidades a todas las madres aquí. But today concludes National Women's Health Week. And as we mark the conclusion of this week, and as we flex our poder, our power here at this event, we want to take a moment today to talk about, again, critical issues impacting our people, including Alzheimer's disease and related dementias known as ADRDs. And something that in the research that I was doing prior to today and learning about so that we could share and discuss and participate in this conversation, nationwide, almost 2/3 of Americans with Alzheimer's are women. Did you guys know that? 2/3. That's crazy. And when it comes to women of color, specifically Latinas, we have been at a disproportionately higher risk. So when we really narrow down these numbers and we see how our mothers could be affected by it, the women that live around us, the women that we know, the women around you could be affected by this disease, and what can we do to prevent it, to help each other out? So that's why we're here today. We want to have this discussion. We're going to be having a conversation, included with all of you as well. So we join you that at the end, if you have any questions, we're going to be doing a round of questions. So I want to introduce our panelists, fabulous ladies that are doing just incredible things, inspiring us, moving the needle in the conversation when it comes to women's health. La doctora Mirella Díaz-Santos, she is a Spanish-English bilingual and bicultural neuropsychologist. And she's also an assistant professor in residence in the Department of Neurology with a dual appointment with the Department of Psychiatry and Behavioral Sciences at the David Geffen School of Medicine. That is incredible, wow. Honor a quien honor merece, increíble trabajo. She's a director and the founder of the Equity for Latinx Hispanic Healthy Aging lab at UCLA. And also her area of research is the implementation of multi-level interventions transforming healthcare systems, research infrastructures, and communities fostering greater accessibility to dementia, clinical care, and trials. So one more time, give it up for Doctora Santos. Next up, we have Candy Calderón. She is the voice of a new generation of all of you women today. She is a certified brain health professional and wellness expert. She's an experienced speaker and a trailblazer in the health and wellness space, especially for Latinas and women of color. She's also the founder of CEO Wellness Club, a company that offers brain and sleep programs. I'm going to need to talk to you because I need help with my sleep. For professionals and leaders of impact in order to maximize performance, life balance, fitness, and longevity. Give it up once again for Candy Calderón. And last but not least, please give it up for Charlotte Castillo. You've seen her running around all day. She is the mastermind behind this incredible event, managing director of Poderistas, and she also lost her mother to ADRD in April of 2021. Charlotte, why did you write such a short bio for you, girl? Like, she's amazing. This woman does it all. So give it up for Charlotte once again. And yes, we're going to have some time for a Q&A with all of you at the end, so make sure that you keep in mind what you're going to be asking these ladies. First question for Dr. Santos. Tell us a little bit, what is Alzheimer's and why is this campaign and caring about brain health so important to you and for all of us here?
Yep.
There you go.
I'm trying. Bueno, buenas tardes, buenos días a todas. Un placer estar aquí. So, very simple because it's complicated to explain. When we talk about Alzheimer's, it's a type of dementia, right? The most common that impacts your whole well-being, your memory, basically who you are. And I'm almost positive, if I have a chance of hands of how many of you and your families have already been impacted by, here we go, by Alzheimer's disease or other type of dementia. So this is very key to our heart because we women are higher risk. A lot of our caregivers are women, and you know all about it. So why this campaign is important, very succinctly, is that initially in the research, we thought that Alzheimer's type dementia is a condition that only affects our older adults. Now the science is telling us that that's not the case. So we are acquiring risk factors all through our lives that increases our risk of developing Alzheimer's and other type dementias. So in many cases, sometimes we're seeing the onset of symptoms before the typical age of 65. So that's why we're having this campaign and just talking about it.
Yeah. Candy, tell us a little bit about the stigma surrounding not only Alzheimer's, but also other brain-related situations within our families, and how do we open the conversations? Because I feel like, I mean, recently my dad said something that I was like, he's he's young and he works out and he does all, everything you could think of, and he's like, tómame estas fotos antes de que me pegue el Alzheimer's, and, because it's kind of like the idea of like in the future, everybody's going to get it or someone's going to get it. And I'm like, what are you talking about? He's like, that esa enfermedad que a todo el mundo le está pasando. So it's also, he didn't even really understand what it was. It was just like he's heard it, and then he didn't really want to talk about it. Yeah. So how do we address these conversations? How do we bring them to light, and how do we help a lot of parents, for a lot of us that take care of our parents or help out our parents?
What we have to understand is also the cultural aspect. We're in Mental Health Awareness Month, right? And I was just discussing how it is still taboo to this day to acknowledge, because our family sees acknowledging that you have any mental health challenge or you need help, if you're seeking help, like a weakness. And it's, let's swipe it under the rug. Si no lo dice, no está pasando, right? And then it shames us if we acknowledge, like, hey, I need some help. This might be happening, and that rings true to any type of cognitive decline. And it was just like, we're not even talking about it. And if we don't discuss it and we're not talking about it, so it's not happening. And it is very culturally true for Latinos, but also for families of color in general. So the more we demystify and we talk about and we have the conversation and we make it like more natural to talk about it, and to also understand that Alzheimer's, people think is a natural illness of aging, and it's not true. We're going to talk about it here. Not because I'm getting old, I am going to get dementia, Alzheimer's, or any other type of dementia, because you mentioned Alzheimer's type of dementia. So we need to be more vigilant and to talk about it and to talk with our kids and with our parents. There's nothing wrong with acknowledging we have a need and to seek help, because if you seek help, things are going to get better, but also have that conversation, communication, and to open the conversation in our community without being a taboo.
Right. You know, it's you mentioned mental health, and I think within the conversation, right, when it comes to mental health, even for young adults, for young people, we're seeing an increase of anxiety, of stress. We've seen it all our lives with our family members. You have to work, you have to salir adelante, you have to pay the bills, and there's no space or time to think about these things, let alone the stigma that comes like, no, estás loco, you know, you don't need these things. Doctora Santos, tell us a little bit about that. Like, how do we even start these conversations, and how do we change this narrative so that early on we can start addressing these topics at home?
Absolutely. So I totally agree, because I was raised with, calladita más bonita, la ropa sucia se lava en la casa. So, and there's always a reason behind it, right? So if you are labeled as a crazy person, that has a lot of repercussions, right? For your work, for your family, and everyone around it. I think one aspect that I have been encountering in community settings lately is that COVID-19 pandemic opened the door for a lot of conversations, right? And I think that the main component to talking about it is to have the language. A lot of us don't know what depression is, or what anxiety looks like, or what how trauma is, how your body expresses trauma, that headache, that migraine, that pain. So I think that once we have the language, once we have a safe space when we are not judging each other, because the worst person, we can be our own worst person first, but then if we're in a setting where you say, ¿sabes qué? Me está pegando la ansiedad, and then your friend or your family member is like, girl, why are you complaining?
Right. Or it's like ponte a trabajar, or like, start cleaning the house. Like, it's going on social media, vecina, like ponte a limpiar, and you're like, wait, what?
Right. Borrón y cuenta nueva. Sí. Right. So the one key component, and as a psychologist, I always talk about it for myself, my family members, and my communities, is that everyone has a mental health. How does it look like? It's different. Can we talk about it and be in a safe environment? I think that if we relied on each other without having those, cutting words, it's like, you're weak. Why are you complaining? Why your life is not hard? Then we need to talk about intergenerational conversations too, right? And I work a lot with Latina older adult caregivers, so they don't even have the language to even talk about their emotions. But once you have the language, the component of Marianismo is huge in our communities. So then it's like self-care, but is it self-care? Am I selfish? But if I taking care of myself, but then my sister or my grandmother or my mom are like, mira, mija, why are you self-care and hiking and mental health, ponte a trabajar, right? We're going nowhere, right? So I think that I'm just raising a few things that I'm almost positive that all of you know, so we feel safe to talk about it. Because I think that we're always waiting for alguien más que lo diga. Dilo tú, doctora. Dilo tú. You have the certification, but we all have a story to tell, and we should feel safe in that storytelling.
Yeah. When it comes to storytelling, I think it's just we hear about all these topics and the language that comes from mental health, but when we try to ground these topics, right, and like really understand it and humanize things, then we hear other people's stories. Charlotte, you have a particular story that is very near and dear to you. Your mother, you lost her a few years ago. Tell us a little bit about that for you, what it was like, how it was seeing her, and how have you also coped with this subject within your family now?
I was thinking about the story and when I found out, I'll never forget, we were on vacation and my dad, who's, in brilliant form, he walks in and he's like, tu mamá le dijeron que tiene Alzheimer's. I'm like, wait, you just got here? Wait, what? Like, it was like a shock. And I didn't believe it, to be honest. I didn't believe it, and it took us some time to kind of understand and I was like, are you sure? Is that the right diagnosis? Because she also had Parkinson's. So my mom had this really kind of interconnected, she technically didn't, she had, she had Lewy body dementia, which is, it's like when Parkinson's and Alzheimer's meet and they have a monster baby, literally. Like, it was tough, right? So she was being impacted physically and emotionally. And at the time we didn't know. Like, this is another thing I think with these dementia type diagnoses, and I'm not a doctor, but I read a lot, is that they don't know exactly sometimes, right? Like, they first said it was one thing. They were like, oh, it's dementia, early onset, because she was pretty young. And then they were like, no, it's Alzheimer's. And like a year later, well, it's not. Like, it kept shifting given her, how it was manifesting. So that was hard because it was like you were trying to, okay, it's this. I went deep. I'm like a Google woman. Like I read, like that's how I found you. I do research. I'm like, I go deep. Can you imagine? I found this Latina amazing expert on this topic. I was like, who are we gonna get? I literally research. But I do that. Like, I went deep in that as I wasn't a caregiver. My dad was her caregiver, but as a child, the oldest daughter, and kind of the one that my dad was kind of relying on, hey, mija, help me out. And they're all so connected. They're all very similar, but then they have all these different little kind of nuances. And I actually was the one who told my dad, I was like, are we sure it's Alzheimer's? Like, I'm not sure that that's exactly what it is because she's doing this other thing. She had a lot of hallucinations. Hallucinations what was starting, which was weird. And backing up, my mom was one of these like super mujeres, right? Everybody thinks, but my mom literally, she was the one that remembered everybody's birthday. Like, she had su librito, and everybody said she's the first one that calls me on my birthday. Primo, hermano, amigo. She just had this memory. She was like one of those people. So that was tough. I mean, that was really tough because it was almost losing who she was. And then towards the end, it was harder because, as you said, it's not just mental. Like, my mom literally passed away because she couldn't eat, like she couldn't swallow. Like, her body forgot how to swallow. I mean, I don't want to get upset, but, it's tough to watch. It was a very tough thing to watch, but me as towards the end, a kind of caregiver, I just went deep in terms of the research and tried to, find support, and find people, but it was hard, I have to say, and it was also hard to find in language. Yeah. And I live in New York, and my parents lived in Florida, and I was trying to get them resources, and in New York there's a ton. In Florida and in Orlando, not so much, and that was interesting to not, at the time, a couple years back, to not be able to find the same level of resource that was affordable, frankly, for my parents. Caregiving in the house, that's a whole other thing. Yeah. To convince my dad to let somebody come into the house to help him, he was like, no, I got this, because I got this, and at the end he was, I need help, and then it was almost too late because it's a whole other story, but it was hard. I don't know if I answered your question, but. It's a hard thing to watch. It's a hard thing to live with. And then now for me, every time I forget something, I'm like, ooh. And people say you can get tested. Yeah. And I kind of don't know that I want that information, but it's a scary thing because it's genetic. It can be genetic, and it can be exacerbated with, behaviors. I know, and I'm trying to be super healthy, but it's scary because I watched it, and it's not just about memory. I'm like, you kind of lose who you are, and that was, and the point where she realized that was happening, that was incredibly hard, because she was like, I am not me any longer. She would come in and out of those lucid moments, and it's hard. I mean, it's a tough disease, but the conversation is important, right? And I think that my family around wasn't as open, almost didn't believe it, and my brother and I were like, that's okay, they can believe what they want. We know what she needs. Right. But it's tough because you want a community, right? You want a whole village. But it's also, it's hard. I think it was for them, they were protecting themselves. They didn't want to believe it about her, and she was the oldest and all this stuff, so.
It's kind of like what Candy was saying too, that it's like, if you don't talk about it, then you don't really it goes away, and it's not very real. Yeah. And you mentioned two things that I think are just so vital when we talk about our community's health, and that's access and language. we see it all around us all the time. If it's hard for us to sometimes manage the systems of healthcare and learn about things and research these things, can you imagine for people that don't have access, that don't have the privileges that maybe we have, or also the language barrier, right? Candy, tell us a little bit about, Charlotte mentioned this, briefly. Were there warning signs? Are there indications that we need to watch out for? Are there things that we should start now if we have older, parents, grandparents at home, or even with ourselves?
Yeah, I want to say something, and I'm so sorry, Charlotte, that you went through that experience. It's something that affects not only our loved ones, but also like ourselves, because it's our loved one, right? And then, señora, yo perdí una uña, sorry. It happens. Yeah, thank you. That's the beauty of live shows. So where was I? Oh, I wanted to say it's so hard. The reason why I got into the space, there's not many Latinas in the brain health space. We need more people. So I'm so proud of you, of the work that you're doing. And I'm proud of myself, and I'm proud of you for sharing your story, because the more we talk about it, the more we normalize this. In my case, the reason why I got into this space and became a professional in brain health is because of my own experience with my mom. My mom is a cancer survivor. And there's something called like chemo brain, right? When a person experiences cognitive decline as a consequence of chemotherapy, it feels almost like insult on top of injury, because you already went through a cancer and now you have to experience cognitive decline because of it. And the warning signs I saw with my mom was like her repeating herself, having issues with her thoughts, recollecting memories, and I became immediately so obsessed with helping her the same way I became obsessed when she was diagnosed with her cancer. Because the reason why Latinas and women of color especially are more prone to these illnesses is not because necessarily, yes, you can have the genetic predisposition, but it's also access, is diagnosis, timely diagnosis, is education, right? So we seek help later on when maybe it's too late, right? So it's the access. So in my mom's case, that we cannot stop Alzheimer's or dementia, but we can slow it down, right? So putting in place these protocols and helping and going to actual professionals and doctors like you, but holistically at home, and also understanding, hey, it's not because my mom is old. That can happen to us already, because cognitive decline related illnesses start giving you hints 20, 30 years in advance. So if you hit your 30s, girl, now is the time. You're in the right place. You're learning, because 30 years down the line is not the time to start taking action. It's right now. So that's why it's so important, the conversation and acknowledging the symptoms, right? If you have a hard time recollecting with your memory, naming things, start thinking about and putting name to thoughts, focusing. That is a hard one. Like, we all suffer from focusing. We live in a nation that it's deprived of focusing because we're sleep deprived. There's so much deficit in attention. So recognizing the signs, I think, is so important. So that's a few ideas.
Yeah. Definitely. Doctora, are there any preventative measures also that we can discuss, or healthy behaviors that Latina women can participate in order to reduce the risk? Are there things that we can start doing, like Candy says, now in terms of preventative, and also including our family members in this?
So when we talk about like reducing our risks, what do you think we're doing right now? So learning something, think about that so I'm as a neuropsychologist, I study brain-behavior relationships. It means that whatever we do behaviorally has an impact in the brain and vice versa, right? So it means that every activity that you do on a daily and nightly basis impacts your brain. So if you gather a lot of amazing kind of like snippets for today, think about, when I wake up, what do I do? right? How much water am I drinking? Because dehydration can impact your cognition.
Look at everyone.
Okay, mi gente.
A tomar agua. This is your moment.
Okay.
Everybody.
Gente.
Water break.
Okay.
Chug.
Beban su agua. Beban su agua. Okay. I need mine, right? Dehydration, and then when we talk about changes in our cognition or our way that think or memory, it's like these are reversible causes, right? So for example, a huge one when we talk about UTIs, if it crosses the brain-blood barrier and the infection goes to the brain, it literally just have an infection throughout your brain. It means that you have delirium. So and it mimics dementia, right? So UTIs are huge in older adults, in senior centers, and like home care living facilities, right? So think about all those reversible causes. So check your woman's health, water. Obviously, it's just like what your doctors always tell you. It's like, eat more vegetables. Reduce your burger. I love burgers, but it's like, okay. So hiking, walking, exercising, movement, like everything that this amazing, thank you for you and your team's effort. Everything that you have here, from spirituality to mental health to movement, everything, think about that. Everything that you do, even when you pray, has an impact in your brain through neurotransmitters, through brain, like neuroplasticity. So think about that. If we're talking about risk and resilience factors, we don't have a lot of control of what this America does to us. I'm very, the stressors that are so systemic that if por más que uno quiera, punch someone, please don't. Right? The law doesn't protect us against that, right? So, but we do have the power of, like, ¿tú sabes qué? Hoy me voy a levantar y si voy a tomarme un journal, like 5 minutos. So think about small habits that you can do today and start being consistent. Another number to know about reducing risk, try something new every day for 21 days. That's what the science does. 21 days, 3 weeks, that's how much time you need to create a new habit, right? Y después de ahí, añade otra cosa más. Y añade otra cosa más. Y piensa, Señor, esto es para my brain health. Señor, esto es para my brain health. And like, it hurts, but it's for my greater. And think about all the time. Todo lo que haga ahora me va a fortalecer mi cerebro, me va a causar more neuroplasticity, more new neurons, neurogenesis, right? A lot of the hippocampus, which is the main area that Alzheimer's disease attacks. So we want to do anything that makes that hippocampus, means a seahorse. Make that seahorse strong and healthy para prevenir, empujar. Si tenemos el riesgo o tenemos la genética, to push it out as much as possible, because when it comes to Alzheimer's, we can have the pathology in the brain, because that's a fact scientifically. Pero that doesn't mean that you will show the symptoms, because your brain is so strong that it will manage that fight y no te va a dejar enseñar the signs. So I think that if you think about it, I think that that's the best way to approach it.
Yeah, it sounds like it's also like going a lot back to the basics, right? My family is from El Campo in Mexico, and my dad always says, our elders used to live till they were 100 and they were functioning, and it was because they were eating organic food, and they didn't have any stress, they didn't have phones, and they had routines. They woke up at 5 a.m. and they went to El Campo, and I think about it, I'm like, it seems like it's so related now that we're seeing a lot of like going back to the basics, right? And Candy, you mentioned something too with sleep.
Yeah,
that I think I would love for you to like add a little bit about your knowledge and your experience.
Absolutely, but before I dive into that, I want to piggyback a little bit into what you mentioned about neuroplasticity and neurogenesis, but getting it back, I think, by the way, I named this panel the Afro-Latina panel, if you haven't noticed. Yay, for the girls. But because of my, I got a DNA test quite a while ago, and just for the sake of, hello, I know, soy negra de la tambora, pero yo quería saber like what is specifically my ancestry was. And a huge part came from Nigeria, right? So when I started to go deep into and getting my certifications in brain health and all of that, I went deep into the rabbit hole of understanding if because of my heritage, I was more prone to develop cognitive decline related illnesses. And what I discovered doing this research is that there was a huge study made with two different populations, one in Ibadan and a small village in Nigeria called Ibadan, that most of the population carry the gene that predisposes you to develop Alzheimer's, and then with a Black American community in Indiana, Illinois, right? And they follow these people for 20 years. And what they discover is that, guess which one developed more Alzheimer's?
Chicago.
You got it, of course. And what that tells me is that, and I say this every time I'm teaching a class, I'm working with you, is that genetic predisposition can be the pistol, but your lifestyle is the trigger. I'm gonna say this again. Genetic predisposition can be the pistol, but your lifestyle is the trigger. These people in Ibadan in Nigeria woke up with the sun, went to bed with the sun, eating close to nature, they work for their food, a concept of society and community, right? And that helps, that changes everything. So yes, let's not get sucked into the, into what society is feeding us and this stress. And I know it's easier said than done, but we have more say into if we develop this illness or no, right? And one of these things is the epidemic of sleep. And let me tell you, one of the biggest offenders when it comes to developing cognitive decline related illnesses is the lack of sleep. Why? When we sleep, our brain does a beautiful, I see you. It does a beautiful process, which is not only cleaning house and rehabbing, but also consolidating thoughts, and that rehabbing process that we need, right? The clean house. And are we not only sleeping, but are you resting? Are you hitting that REM sleep, which is the rapid eye movement, but are you going into deep sleep where really regeneration happens? If you're not giving your brain enough sleep and oxygen, it will suffer. So we see a lot of people, and it's like causational or correlational. People who lack, are sleep deprived, right? Developing cognitive decline illnesses, or even memory issues. It doesn't have to be Alzheimer's. And you see, and most of them are sleep deprived, right? So, of course, we're not here just to give you the bad news. The good news is that you can, you can optimize your sleep. Your sleep oasis, the place where you sleep should induce to have quality sleep, dark, cool, clean, declutter, smells good. Are you taking care of your room, the first step, without spending any money, without no melatonin, nothing, nada? Start with your room, I would say.
That's so insane, because in news lately, I feel like we've been talking so much about like melatonin, NyQuil, ZQuil. What else can we take? The tart juice, anything that we can do, right? Isn't it like a mocktail right now at night with tart cherry juice or something? I'm like, yeah, it's like all these things, even with children, with little kids, because they're so hyperactive that it's like, well, dale una pastillita para que, which is, if you think about it again, going back to the basics, the simple, the grounding, the nature. And that to me is just, pivotal and like so important when we see it in our communities and with our loved ones. Charlotte, you mentioned that you were doing a lot of research, that you were trying to learn, that you were trying to do as much as you could for your parents, even though you were far from them, from your mom in particular. What were the resources, the support systems, the groups, the things that you learned along the way that helped you and that helped your mother as well?
I don't remember the specific organizations, but there were some out there. There were some lots of PDFs, right? Lots of things that I printed out, but you know, in our cultura, what I was going to do, send my dad a PDF, like it just wasn't enough. What I was looking for was, and also trying to convince him, like, is there a support group? You know, because I felt like he needed that support as well, because that's tough to see your partner, your life partner, going through this. And he was her caregiver. He was very resistant to it. I mean, but I still mentioned it to him. And then I said, oh, and something is there somewhere she can go so that it gives you a break, but she's also with other folks? So those were the kinds of resources that I was looking for. And again, I think they're consistent around the country. They lived in Florida. They lived in a very specific space, and they just were non-existent. But I knew that that's what they needed, so I tried. I would buy him books. I bought her, you know, when it was earlier in the cycle, I bought her the same thing, this idea of learning something. She used to like to do like word things, right? So I would buy her all the books big because her eyes were going too. So really big, bubble, find the word bubbles. I bought her like an art set. So anything that I could do just to kind of help her, but it was met with a lot of resistance. But, you know, I was like, look, mommy, one day you'll try to, you'll open it. But I think it shouldn't be that hard. And not so much about the convincing, but the finding of the resources. It really shouldn't be that hard, especially with the numbers that we're seeing. Forget just for Latinas and women of color, just in general in this country. Like, there needs to be more advocacy around that. I mean,
and that's one of the things that, and I'm glad you mentioned that, because remember what I said, it's not that we are predisposed more than other demographics. It's just the lack of access, the lack of education. So we don't know, we're not taking care of ourselves as we should because we don't have the access. So sometimes it's up to the elder daughter, the eldest son, if he cares, to have a good wife, you know. So sometimes we have to. Yes, so true.
I know, my brother lived in Florida, by the way.
My mom shows me que yo espero que se case con una mujer buena, porque you know what I mean. El hombre se olvida de las mamás cuando. So it's up to us to look for that information. But if the information is not out there, or sometimes, like, we have the privilege of being bilingual, but what if those people who do not speak English? Language is very important. That's why I think that this campaign that the Alzheimer Association is doing, and thanks for having us here, is so important, because we're also giving access, and now you go and take it to your homes, and it's a beautiful ripple effect, right? That we're all taking action, and I think it's so important.
Yeah, and even with like language and like cultural nuance, right? When it comes to like doctors and access and learning, like I see it a lot again with the stories that we do of like patients that trust their doctors because not only are they speak the language, but they're Latino, so they understand that the holidays mean something, or that this is very important. You know what I mean? The cultural like nuance in a lot of the things that we do are like vital. Doctora Santos, can you add on that? Like, where can people go? Resources, help, support system. How does the medical space work in our favor? How can we take advantage of it somehow and learn from it?
I'm trying to inhibit a lot of emotion because when we talk about the healthcare system, let me give you some data. So here in California, 7% of the healthcare workforce, primary care physicians, doctors, are Latinos. Only 7. Only 4 are Latina women, right? So we are here in California. Right? And we're talking about LA County. LA County is what? 49. And 38% of us are either bilingual or trilingual, right? We also need to talk about our Latino indigenous communities that have very specific languages that we're not even acknowledging, right? Right. So when we're talking about that dichotomy in English and Spanish, why is it that we only represent 7%? When you're talking about the field of Alzheimer's, we're less than 2% Latinas. When you're talking about Latinas that do research at an R01 like institution at UCLA, I'm the only one in my department. Wow. Why is that? ¿Me entiendes? Como que, why is that? It's very systemic because obviously the structures are cutting our wings from even before we were born, right? Oh, absolutely. No, yo me estudio mis determinants of health because I think that one aspect that we are trained in healthcare, medicine, grad school, is that the system loves to blame us for everything. It's like, you don't drink water. You have diabetes because you eat poorly. It's like, so tell me why is it that all the food that is nutritious for me, I cannot freaking afford it, right? Why is it that I don't have safe access to green spaces when the literature, going back to the basics, is telling us that our nature, Mother Nature, our land, has kept it alive? So why are we still blaming us when this is the result of a capitalistic world, right? So the same thing happens. Sorry, let me take. you know, it comes out. It's like my boricua sale.
Yeah.
So then it's like, let's stop blaming us. Let's, like, while we were talking about advocacy, mi gente. Let's go to Sacramento. Yo le llego a DC. This is a Latina issue. Why is it that no one is giving us the spaces to tell our freaking stories? ¿Me entiende? Estamos en California, right? So use your voices, your lived experiences, y le dejan saber a like legislators and everyone here that we deserve a life that brings us down of all these chronic conditions. Of diabetes, hypertension is huge, and these two increases our risk of Alzheimer's and other dementias, including vascular. Meaning, how many of us know someone or some of us that had a stroke? Right? So that leads to also dementia. So I think that that's when it talks about healthcare, it's like let's advocate like por qué nuestras comunidades no están like we are getting lost in the transitions from middle school to high school. Why is it from high school you only get advice to go to community college? Right?
School, yeah.
It's like who is in leadership, right? And advocate and know that we're not many, but we're here with you. So que nos buscan, it's like we need a healthcare system, psychologists, neurologists, primary care, family medicine that looks like us. Porque ahí, with what the science says, obviously, si tu doctor o tu doctora can see you for who you are and doesn't blame you for your environment, the health outcomes are better. So why am I stuck with a freaking white man that wants to blame my family about like all the intergenerational trauma? It's like, white man did that. Okay, so let's stop that. Sorry, let me come back.
We love it. Yes. Speaking facts. And to add to that, something really, really interesting when you mentioned, Dr. Santos, like recently we worked on a special about trees in LA. And we drove through, I think it was like Olympic or one of these streets that goes from the west side to the east side, looking for trees, for green spaces, looking for parks along Olympic Boulevard. Do you want to know where the most trees, the most parks, like literally just everywhere else? The west side, parts of the west side. And where do our people live? In the east side. And it was just, in terms of the temperature, just having a direct connection to the sun, right? No access to trees, no access to green spaces, no parks. They were getting rid of our parks in these spaces where these are the only areas where our kids can run, walk, play. And we cannot completely disregard those things, right? When it comes to going back to the basics, going back to nature. So hopefully, you're taking for all of this and seeing what Dr. Santos mentioned right now, what is it that we can all do to change that narrative, to advocate for these communities? Because we are what we have right now. Like this is it. Last question before we open it up for questions from everyone else. Would love to just round it up. One key takeaway, something that you've learned along the years of your experiences and research and advocacy that you want all of us to take today and you want us to implement today as well.
Me first?
Charlie, you go first.
I need to sleep more. No.
Two of us. I got you. It's two of us.
I do. Well, two things that I learned. I definitely learned today, but I've also heard before. Two things: sleep. I have to get better at my sleep. But also learning something new. This was something I learned a few years ago, and I was really fascinated by this idea that you don't have to go deep. It's actually, do a bunch. Just keep, and that's what really excites and kind of builds all the neuroplasticity. Like I did guitar lessons for 6 months, and then I was like, next. And then I started doing Zumba, like next. And that's actually better for your brain than just going one thing really deep, which I thought was really fascinating. And for somebody like me, that it's like, from an attention perspective, it was perfect. So
it's kind of like my mom tells me, estás en todos lados menos en misa, right? And I change it for her. I'm like, estoy en todos lados y en misa también, like a little bit of everything.
A little bit of everything. So those are the two things that personally I'm trying to do. The sleep, it's a work in progress.
I got you, girl. So there's something, and you mentioned neuroplasticity, and I want to bring it back. Something that I want you to take with you today is that you're not stuck with the brain you have right now. Like neuroplasticity is the ability of your brain to heal itself. And so that is so important to understand because that gives us hope. Remember what I told you? Predisposition, even if you don't carry the gene that predisposes you to develop cognitive decline-related illnesses, but your lifestyle can be the trigger. So with neuroplasticity, that tells us, yes, there are things that I can do proactively to take care of myself or even heal my brain. Of course, there's people with concussions, that's different, but let's part from a ground that you want to optimize what you already have and you want to improve, right? So we take so much care of our body, and we're always thinking, oh, let me go to the gym, let me la pompas, tan parada, all the things. But we rarely think about exercising the biggest our biggest asset, which is our brain. And the same way you exercise your body, you should be exercising your brain. How can you exercise your brain? I'm going to give you a few tips so you can take home and start doing right now. How many of you here write with your right hand? Okay, so the left are lefties, right? So start writing with your non-dominant hand. That is an excellent brain exercise. It triggers your brain to use different areas of that you typically don't use, because when you write with your dominant hand, you almost do it like by default. You're not thinking about it. It's almost like breathing, right? So write with your non-dominant hand. You can also brush your teeth with your non-dominant hand.
Drive too, maybe.
Don't drive with your non-dominant hand. We don't want you to crash.
No. We
I was trying to be.
If she comes out in the news tomorrow that she crashed her car, God for que dio la libre.
I was following your instructions.
I'm not liable.
Poderistas is not liable for that.
Poderista is not liable. What else? You can brush your hair with your non-dominant hand. Sudoku, you can do eat. Sudoku, you can play Sudoku. Is excellent. Crosswords, you mentioned that you bought excellent brain exercise. You need to keep your brain on your toes, because if you don't use it, if you go by default instead of intentionally, it becomes weak, right? So we want to strengthen it and do things every day intentionally to make it strong. The foods you eat, and you will see that many of the things that we tell you will also possibly impact your overall well-being. Eat as less processed food as possible. Our brain loves good fats, and we're so afraid of fats. But the good fats are important. Avocado, nuts, olive oil, fatty fish, sardines, salmon, which has the omegas, which are so important to develop and to heal a brain and to keep your brain sharp, because it's important to keep, we're thinking about the future, but what about now? I want a sharp mind right now. Like I want to cut in the air. That's what I want to do always, right? Hydration, you mentioned hydration, right? So I'm giving you a lot of things. When was the last time you learned a phone number? I don't remember. Learn a phone number. Learn a new route without the GPS, without Google Maps. You see?
That one, Candy. I don't know about that one, girl. Have you been driving in LA?
But you see how we become complacent about relying, and then we stop using our brain. But it's so easy. Remember, non-dominant hand, learn a new phone number, brush your teeth with non-dominant hand, fatty fish, good fats, hydration, probiotics, right? Fermented foods are amazing. We need good bacteria. People are afraid of bacteria, but we need good bacteria for gut health. The gut and brain axis is real. If your gut is not healed, your brain will suffer. Fermented foods like kimchi, sauerkraut. Who loves kimchi and sauerkraut here?
Kombucha?
Kombucha too, okay? Tempeh, which is a good substitute for those of you who are plant-based, right? So all of those things, and if all fails, yes, you can supplement. People demonize supplements, but I think about them as a crutch. As an insurance, not as a crutch, right? Because life gets in the middle. Sometimes I might not be able to eat fermented food every day, or salmon or sardines, you know what I mean? So a good supplement, and be mindful of the things that you eat.
And sleep.
And sleep, of course, that's a given, and sleep. And so yeah, I hope you take some of those. Oh, you mentioned dancing, and dancing is amazing, but not dancing for the sake of dancing, but the dancing where you're learning new steps and choreography, because learning the new patterns, again, create, and you mentioned neurogenesis. People think we cannot create new neurons, and that's a lie. Neurogenesis, your brain is capable of creating new neurons every time. So that means you're getting smarter. So when you learn new steps, you do that Sudoku, you do that crosswords, you are helping your neuroplasticity, neurogenesis. So I hope you at least implement one or two today, tomorrow, and every day.
Love it.
Oh, very brief. Trust your body. Trust your body. Listen to your body, right? Pay attention to your body. If your body is aching, pay attention. It's like, and don't get me wrong, I have sciatica, so I got you, right? So pay attention to your body, believe your body. Pause when something is aching, because your best friend is your body. Your body will tell you that something is off, right? It's just like life gets really complicated, and then the expectations of the family and culture and community and this, and you need to obviously pay the bills because this inflation is not helping us at all, right? But pay attention to your body, because she's your best friend and she'll tell you. And another thing, once you start seeing paying attention to the symptoms, write them down. Write them down. I'm having a headache at this time. So you can have something written, and you start evaluating whether there's a pattern. Gotcha. Right? Whether there's a pattern. And then when there's a pattern, onset and progression. When did it start? What's the frequency? What are the symptoms? What's the condition? And then go to the doctor. Take no for an answer, because obviously we already talked about the discrepancy between healthcare that doesn't represent us. And we have in the healthcare system, and we can talk more about this, is that Latinas are hysteric. Tenemos una histeria y nosotras nos quejamos de todo y esto y lo otro. So fire that provider and find someone that actually believes your symptoms, because when you're talking about access, many times I'm a cancer patient and I'm a UCLA professor, and I had to fight with my provider to trust that something was happening with my body. If I had all the intersectionality of privilege, right, and I had to fight, and then they'll find that it was cancer, and then, now you want to hide because I was right. Imagine the rest of our communities, including yourselves, of shit, this is hard, right? So, but know that we're here for you. So I think that's kind of my message.
Love it. Lovely. Thank you so much, ladies. This was beautiful. This was so special. We want to open it up to any of you that have a question, a concern, a comment, something that you'd like to address. Oh, we have a few hands up here. Okay. Do we want to pass a mic, guys, or do we just, or do you want to just stand up, maybe give us your name and then your question?
I have a mic here.
Oh, get ready.
Oh, yeah.
There you go.
Hey guys, my name is Irma, and my question is this. So I've been kind of evaluating my own self-worth, and my grandmas, my moms, and just generations of self-worth. How does that mental health component of self-worth, in your opinion, trigger into the body, into the heart, into the mind?
powerful question.
I can go really quick, but I'll...
Yeah, no, go ahead. Dale.
So the answer is, I'll try to be concise because it's deep, right? Porque when we talk about self-worth, it means that you're taking a step in to say, I'm going to pause and create boundaries to figure out myself and how that's identity that I have acquired or it was imposed onto me, how it has impacted how I communicate with the world, how I interact with other people, and understanding those patterns. So self-worth impacts your whole being. And that's one aspect, right? But then is the aspect of boundary. We don't have a Spanish word for boundaries. FYI, I checked with my caregivers and I said, we don't have a Spanish language equivalent. So para dejarte saber es, we need to have self-care and everything is, it will align, but you have to create a lot of boundaries that people are going to hate you for it, including your own mamá y abuela y tía y cuando venga la Navidad, it's like, mira, porque ese whole self-care. So you just have to know that that's coming, pero it balances everything. Podemos seguir hablando.
¿Podría ser límites? Límites, no? That's not the same, right?
No sé, like we need
En buen dominicano sería quédate en tu esquina, right? Yeah, quédate en tu esquina.
I like that one better.
Yeah.
We have time for one more
5
question?
minutes.
5 minutes? Okay, one more question. If up here, yeah, you can come up here. Yeah, pass it. So let's make them short and sweet, ladies.
Okay, sorry, okay.
First of all, I am so proud to have so much Caribbean representation. My family's from Cuba, so.
Oh, you sit right here, the three.
I know. Soon, I hope. I had a question. So I was wondering in the data, for those of you that I know you're a neuropsychologist, in the data, is it able to reflect at all how much of an impact coming from a Latino background and coming here impacts it in the sense of losing that sense of community? In terms of like neurodegenerative diseases, does it impact at all?
Mira, te voy a ser bien sincera, I'm going to be very like succinct. We don't have a lot of data, right? So start there. We don't have a lot of researchers that are Latinas, and we, for a lot of reasons, we actually don't participate in research. So to answer that question, we actually have to co-develop that research question and that study design. One thing that is known in the literature is the Hispanic paradox, that generations that came from the native countries and immigrated have better health than the generations that were born and raised here in the States.
Interesting.
That is data that is consistent. So think about like going back to what we're talking about in like de nuestros países, you know, tenemos la cultura, tenemos nuestra gente, and we bring those things with us. Pero cuando estamos aquí, there's like that American probably identity that comes with a lot of those other factors, como tú estabas mencionando con ese estudio, right? That makes us more vulnerable. Yeah.
Wow. One more question.
I'm wondering if there's any research that discusses the effects of fasting and what it does to the gut and to the brain to reboot and rewire some of those cells.
So, and we go back again, we have to be very careful. What we do know with the papers and peer-reviewed studies is that we as women, we should not be fasting same as men. Our bodies are different. We go through cycles. Our hormones are different. And women tend to follow blindly and fast and do these crazy crash diets just as men do. They affect their gut in such a way, and remember what I told you about the gut-brain axis? That is imperative that we take care of and that we are very intentional, because if your gut is unhealthy, your brain will suffer. And you mentioned something very important and real quick about, for example, women with UTIs. The same also for oral health. If you have decay, if you have caries, right? I don't remember how you say that in English. Cavities. And all that bacteria also can go through to your brain. So you have to take, remember, bacteria. So, so you have, if we take care of our gut, and it's honestly, unless you have a chronic illness, healing your gut, it's simple, not easy. Simple in the sense of less processed food, be mindful of sugar, good bacteria, good probiotics, and hydration, and the emotional part, which is so important, right? Remember, the hormones, the happy hormones, is actually in our gut, not in our brain. Good sleep, stress. So all those things will help you heal your gut and by proxy, your brain. So I feel that going back to your original question, women should not fast the same as men. And fasting, honestly, I would say, take in consideration your cycle, right? The different phases of your cycle. We are not meant to fast for long periods of time like men do, remember? But yeah, I would say your main focus point should be to healing your gut instead of fasting.
Absolutely. Okay, we don't have much time. We don't want to take a lot more of your time, but again, thank you all for being here with us today. Gracias, Doctora Mirella Díaz-Santos, Cami Calderón, Charlotte Castillo, for your expertise, your experience in sharing all this information with us. And just to close it out, a few notes to recognize the signs of Alzheimer's, for others to start a conversation with friends, loved ones about healthcare, learn ways to reduce the risk, and together we can take on Alzheimer's as a community, as individuals. So thank you so much for being here.
And can I say something real quick? If you learned something here today, go and apply it, because we can give you so much information, but if you just absorb that and do nothing, then you just wasted your time here. And if you learn something and you take action, tag us. We want to see you in action. Find me, Candy Calderón _ Charlotte, Poderistas, Yarel. So what's your handle?
Oh,
On social media.
Mirella Díaz.
Okay, so find us and tag us. We want to see you in action, okay? I want to see you writing with your non-dominant hand, doing a mess, writing your name. We want to see, not driving. Okay, thank you so much for coming today.
Okay, wow, guys, that was so powerful. I learned so much. I'm deciding on what I'm going to do for the next 21 days. Is it a salsa class? Should we start here today? Thank you, Yarel, Candy, Dr. Díaz-Santos, and Charlotte. Thank you for sharing your very personal story. Before we continue with the day, guys, we're going to watch a short video from our fantastic sponsors of the day. Let's give them a round of applause, and I'll sit while we do this.
This is what it takes to take on Alzheimer's. Awareness of the fact that nearly 2/3 of people diagnosed are women. Courage to accept that memory loss that disrupts daily life could be a sign of Alzheimer's. Dedication to lowering your risk by staying active and monitoring blood pressure. And support from family and friends to talk about signs, screening, and early detection. Take on Alzheimer's. Learn more about signs and screening at takeonalz.com. Brought to you by the California Department of Public Health.
All right, that was amazing. Really quick, guys, I want to share a little anecdote that happened just this week that's very applicable here. My mom, for the last 3 years, has been going to a doctor. She's been experiencing severe pain in her entire body. This is just going off of what was just spoken on the panel. And her Caucasian doctor, she would go in and to see the doctor regularly and saying, I don't know what's happening, my entire body hurts. And he said to her verbatim, you can only tell me 2 things at a time. I cannot hear all of your symptoms. My mom now has found a Latina doctor, and she's been diagnosed with an autoimmune disease. So I'm saying all of this to say that if you feel, listen to your body. If you're feeling something that isn't right and you're not being listened to, you need to change your doctors. Okay, so now it's time for the next 2 cycles. Who's excited? Who's ready? What are we? All right. So very simple, we're gonna follow the same format. If you have a green wristband, you're gonna move to spirit and then to community. If you are naranja, you're gonna move to comunidad and then back to this room for mind. Are you guys following? Okay, is there, okay, there it is. And if you have cielo, you stay right here for mind and then head to body. Tierra, you go to body, and then you end in spirit. And I'll see you guys upstairs at the Modern News table. Don't forget to sign up for the raffle.
That's good.